Hey, so all, welcome back to my YouTube channel. Today we are going to study about a very important topic that are triangles of neck. You can get even a long note on this topic or even a short note for the 15 marks or for the 5 marks. So do listen to this topic very sincerely and with your full concentration. Okay. So first of all, we are going to study about the anterior triangles of neck. So in this diagram, there are marked structures. First of all, you can see, I will change the pencil color for you so that you can differentiate easily. First of all, we have the submental triangle, carotid triangle, muscular triangle, or you can either call it a digastric triangle. Submandibular triangle, it is also called as digastric triangle. These four are the anterior triangles of neck. This pink space is the digastric triangle. This triangle is called as the submental triangle. The carotid triangle is the triangle where we can also feel the pulse if we place our two fingers there, and then we have the muscular triangle. And what are the two posterior triangles? Two posterior triangles are the involved are the occipital part and the supraclavicular part. Okay, this is our sternocleidomastoid muscle. Okay, this is the belly of omohyoid. This is our this structure is the superior belly of omohyoid, and this structure is our inferior belly of omohyoid. Inferior belly of omohyoid. So the posterior part triangle is divided into the two parts with the help of inferior belly of omohyoid. The first part is called as occipital part, and the downward part is called as supraclavicular part. So this is first and this is second. So you have to remember the names of anterior triangle and posterior triangle, then only you can study about them. Anterior triangle are the submental triangle, digastric triangle, carotid triangle, and the muscular triangle. And the posterior triangle are two, that is the occipital triangle and the supraclavicular triangle, that are divided with the help of inferior belly of omohyoid. Okay, so first of all, you can see I have mentioned all the structures that are seen. This one is the anterior belly of omohyoid, this one is the posterior belly of omohyoid. Okay, so I will draw a simple diagram for you as a basic. This is also simple, but I will draw a simple one. This is submental triangle, this is digastric triangle, this is anterior belly, this is posterior belly. Okay, then downwards, this one is our sternocleidomastoid muscle. Okay, then the structure running downwards, this one is our superior, and this one is the inferior belly of omohyoid muscle. Okay, so this triangle is our carotid triangle. So this one is our occipital part, and this one is the supraclavicular part. These two are the part of posterior triangle. Okay, so anteriorly we have, this is the muscular triangle, Okay. So these two are the, so you can see, first of all we will begin with our submental triangle. Submental triangle. On the sides of the submental triangle, we have two bellies that are anterior and the posterior belly or digastric. Okay, this is the base of it is formed with the help of hyoid bone. The floor of it is formed with the help of mylohyoid muscle. Okay, you have to remember this thing about the submental triangle. Submental triangle is bounded by these anterior belly and the posterior belly or digastric. The floor is formed with the help of mylohyoid muscle, that you have to remember, and the base consists of hyoid bone. Okay, then we are going to discuss about the digastric triangle, also known as submandibular triangle. Digastric triangle is also known as submandibular triangle. Remember, this is anterior belly involving the anterior part, posterior belly involving the posterior part, and above to it is the base. Okay, so anteriorly we have anterior belly of digastric. Posteriorly we have the posterior belly of digastric, that is anterior inferior and posterior inferior. We have respective anterior belly and the posterior belly. Okay, at the base or at the superior region we have base of mandible. Okay, and the floor of it involves the two muscles, that is mylohyoid along with hyoglossus muscle. You have to remember the muscles involved. Rest all of you can remember by watching the diagram. Digastric muscle basically involves anterior inferiorly with the anterior belly, posterior inferiorly with the posterior belly. The superiorly or the base is formed with the help of floor or the base of the mandible, and the floor involves the mylohyoid muscle and the hyoglossus muscle. Muscles of this you have to remember. Next we will study about carotid triangle. Okay, as you can see in this is the carotid triangle. So look at this. I will draw a simpler version of diagram for you. This is the sternocleidomastoid, this is the posterior belly. Okay, and this is the superior belly of omohyoid. Okay, so this is our carotid triangle. So it has the parts of it are as follows, that is anterior, superior and posterior. So what can we see? Anteriorly or anterior inferiorly we can see the superior belly of omohyoid. Okay, superior part we can see the posterior belly of digastric. On the posterior side we can see the sternocleidomastoid. Okay, floor of it is formed with the help of middle constrictor, inferior constrictor and the thyrohyoid membrane. Floor of all the triangles are very important. It involves middle and inferior constrictor along with thyrohyoid membrane, that all of you should remember. Okay, and roof you can with the help of skin, fascia. Okay, so submental triangle floor was formed with the help of mylohyoid muscle. Digastric triangle or the submandibular triangle was formed with the help of two muscles, that is mylohyoid and hyoglossus muscle, while the carotid triangle floor is formed with the help of middle constrictor, inferior constrictor and thyrohyoid membrane. And then the most important thing in this is the contents. It involves artery, veins and nerve. What are the arteries involved? What are the arteries involved that we will study? Basically, it involves the common carotid artery involving the internal carotid artery and external carotid artery. It doesn't involve all the branches of external carotid artery. Basically, it involves 3 anterior branches that I have mentioned in my videos earlier. You can watch them. Here I am also mentioning them again. 3 anterior branches were superior thyroid, lingual branch, okay, and the facial branch that you have to remember. And there was one medial branch, 3 anterior branch, 1 medial branch, that was the ascending pharyngeal branch. And in the case of external carotid artery, we have the 2 posterior branches that were the occipital branch and the posterior auricular branch. But here we only involve 1 posterior branch, that is the occipital one, not the posterior auricle. Okay, so you have to remember this. Then what are the veins involved? Basically, it involves the internal jugular vein. Okay, you can remember this, or they can involve the common facial vein, pharyngeal vein or the lingual vein. Then what are the nerves involved? Basically, it involves the 4 nerves that you should remember. It involves the vagus nerve, superior laryngeal nerve, spinal accessory nerve and hypoglossal nerve. Okay, you should remember these 4 nerves. What are the contents of the muscular triangle? It involves common carotid artery involving the internal and the external. Among the external, it involves 3 anterior branch, 1 medial branch and 1 of the posterior branch only, that is the occipital, not the posterior auricular. But it doesn't involve the 2 terminal branches also. It involves 1 vein, that is called the internal jugular vein, and 4 nerves. What are the nerves? It involves the vagus nerve, superior laryngeal nerve, spinal accessory nerve and the hypoglossal nerve that you should remember. These are basically the contents of carotid triangle. And you should remember that whenever person falls down due to any of the reason, or when the person falls due to any kind of not eating the food, not of energy, any of the reason the person lies down or falls down, you can always look for the pulsations felt with your finger at the carotid triangle. It is a question asked where we can feel the pulsations. Pulsations can always be felt in carotid triangle. Okay, this was the 3rd triangle. Next we are going to study about our muscular triangle. Muscular triangle. As in the diagram, you have all seen what is the muscular triangle. This part is the hyoid bone, and at last this is the it is the hyoid, and at the base what we have, this is the sternum. So anterior part of the muscular can extend from hyoid to that of sternum, and the posterior superior part will be the superior belly of the omohyoid, and the posterior inferiorly we will have the lower part of the sternocleidomastoid muscle. Okay, I will draw this diagram simpler for you. Like, this is our sternocleidomastoid muscle, this is the superior and the inferior belly, and this is the triangle. This is the muscular triangle. Okay, this is hyoid, this is sternum. So anterior part is from hyoid to sternum. Okay, posteriorly and posterior superiorly we have superior belly of omohyoid, and posterior inferiorly we have sternocleidomastoid lower part, as you can see in this diagram. Okay, then we will see what are the contents of the muscular triangle. Basically, the floor of all of them are important. Let's recollect. In the case of submental triangle, let me show you. The floor was formed with the help of mylohyoid muscle. In the case of digastric triangle, it involved the mylohyoid muscle and the hypoglossal muscle. In the case of carotid triangle, it involved the middle inferior constrictor and the thyroid membrane. And now we are going to study about the muscular triangle. What are the structures involved in the floor of this? Basically, it involves the group of infrahyoid muscles that all of you should remember. Infrahyoid muscles involve the four muscles that all of you should remember. Firstly, we have sternohyoid, omohyoid, sternothyroid, and thyrohyoid. We have sternohyoid, omohyoid, sternothyroid, and thyrohyoid. Okay, you should remember this words very carefully. The first three muscles, that is sternothyroid, omothyroid, and sternohyoid, these muscles are supplied with the help of ansa cervicalis. These are supplied with the help of ansa cervicalis. Okay. While the last muscle, that is the thyroid, they are supplied with the help of C1 through hypoglossal nerve. This thing you should remember thoroughly. There are basically two muscles that are supplied with the help of C1 through hypoglossal nerve. First one is the thyroid and second one is the genoid. But genoid is not a part of infrahyoid muscle. It is a part of suprahyoid muscle. So I will write down here. C1 through hypoglossal nerve involves thyroid along with genoid. It supplies these two. So what are the infrahyoid muscles? Basically, they are sternohyoid, sternothyroid, omohyoid, and thyrohyoid. So sternohyoid, sternothyroid, and omohyoid are supplied by ansa cervicalis, and thyroid and genohyoid is supplied with the help of C1 through hypoglossal nerve. What is the basic function of infrahyoid muscle? They depress basically our hyoid bone. Okay, so you should remember this. They have the function of this. You have to remember all these muscles very carefully. So to differentiate from this, the content of it is only infrahyoid muscle. Then we will study, sorry for the disturbance. So next what we are going to study is about suprahyoid muscles. Suprahyoid muscles are also of four types that you should remember. First one is our stylohyoid, mylohyoid, genohyoid, and anterior and posterior bellies of digastric, that all of you should remember. What are the infrahyoid? Basically they are sternohyoid, sternothyroid, omohyoid, and thyroid. You should remember the word sterno there. And while in the case of suprahyoid, we have stylohyoid, omohyoid, genohyoid, and the anterior and the posterior belly of digastric. What you should remember there? In the case of infrahyoid, we have the word sterno. Remember the word sterno there. While in the case of suprahyoid muscle, you should remember the word stylo or hyoid in the last. Okay. So So basically stylohyoid is supplied by the facial nerve. Okay, mylohyoid is supplied with the help of nerve to mylohyoid, nerve to mylohyoid. Okay, genohyoid basically origin is from two of the genial tubercles, that is the superior and the inferior genial tubercles. Okay, I will mention genohyoid origin from genial tubercles. Okay, basically we have two genial tubercles, two of them are superior and two of them are inferior. Superior one is called as genioglossus and inferior one is called as geniohyoid. Okay, and this muscle that I have mentioned in the infrahyoid group of muscle also, that genohyoid is supplied by C1 through hypoglossal nerve. Okay, this is very important that you should remember. And the fourth one is the anterior and the posterior belly of digastric. In my second video of embryology, I have taught where is the anterior belly and where the posterior belly or digastric is involved. I am mentioning here also, but please do watch that video also. Anterior belly or digastric is involved from our first arch, and the posterior belly of the digastric are involved from our second arch. Okay, so nerve supply of it is from the mandibular nerve, and the nerve supply of the posterior part is from facial nerve. Okay, the anterior belly of the digastric is originated from digastric fossa, and the posterior belly of the digastric has originated from masseteric notch. Both of these belly meet at the point at intermediate tendon and perforates our stylohyoid, that is the suprahyoid muscle, and perforates stylohyoid muscle. These are the things that you should remember about the suprahyoid group of muscle. Basically it involves stylohyoid, mylohyoid, genohyoid, and anterior and the posterior belly of digastric. Stylohyoid is supplied by the facial nerve, mylohyoid is supplied with the nerve to mylohyoid, genohyoid is basically supplied by C1 through hypoglossal nerve. Along with this, is also supplied with this, and anterior and the posterior belly of digastric are originated from the first and the second arch respectively, and the origin nerve supply to them is the mandibular nerve to the first and the facial nerve to the second. Okay, origin is from the digastric fossa and to the masseteric notch respectively. So you should remember about these four triangles. First of all, the submental triangle, then the digastric triangle, then the carotid triangle, and then our muscular triangle. So remember all of these triangles very carefully. So today we have completed only the anterior triangle. Okay, in the next video we will study more about the posterior triangle. So if you do like this video and find this informative, please share with your friends and like and subscribe to my channel. Thank you.